Hello, this is Dr. Bob and Debbie DeMaria once again for a half-hour health program. And you're not going to believe this, but Debbie and I are in AARP. I know we don't look that old, and we have been members for years. It has great benefits. We get in movies at a reduced fee. No, I'm just teasing with you. We get their newsletters. And what's happening today is that we're in the thick of the baby boomer movement. Debbie and I have been working diligently worldwide to make a difference in people's lives. So I just recently read a very fascinating statistic. Are you ready for this? 116 million Americans have pain. That means 1/3 of you right now watching or listening to me anywhere in the world have pain in their body. I've also read very frightening statistics that a person will die every hour, and I've read all kinds of numbers on this, from the bad effects of pain medication. The medication is addictive. I read the major business newspapers every day, and every day in the newspaper I read about a medication that has bad effects. So let me tell you something really that most people don't realize or they don't want to talk about. And I'm going to be really real with you right now because I'm trying to save your life. I recently read in the Wall Street Journal that over 300 scientific articles that were in peer-reviewed, accepted journals have been retracted in this past year. You can say, Dr. Bob, what are you saying? They're lying. They're fabricating information. I am not making this up. It is in the Wall Street Journal. There was a recent one at the Mayo Clinic that the person used government money for the research, fabricated the results. He got fired or she got fired from their job, but over 100,000 people were impacted because of this fabricated information. I don't know if you understand the seriousness of what I'm talking about, but a lot of the information, the scientific peer-reviewed information, is a lie. And unfortunately, the material could go out for years before it's retracted. Almost every day they're taking a drug off the market. So we are dealing with a condition today called polypharmacy. Too many drugs. So we're here to literally save your life.
And how are we going to do that? Well, it's pretty amazing because on our way here this evening to broadcast this show, we were saying, what can we bring to you that is like right now, the at the moment, on the spot, on the TV, in the newspaper. And it was amazing because I happened to bring our magazine, the AARP magazine, in the car just so I could flip through it. And God answered our prayer on what we could bring you because we know a lot of the answer to this. Let me read a few things to you. Fueling the fire for Dr. Bob. Well, this said, the symptoms were sudden and severe. Tightness in the chest, dizziness, nausea. I thought I was having a heart attack, says 59-year-old Lynn. Can you imagine, 59-year-old, okay? She was rushed to the emergency and spent 2 days taking tests to find out everything was negative. What they discovered, though, was the unexpected side effects from a prescription drug that she had started taking 3 weeks earlier to manage a mild thyroid condition. And mind you, 1/3 of the United States is affected by thyroid. Her experience is not anything that is not unusual right now. And how many times that people are being affected by what they have actually made a name for, and it's called the cascade, the drug cascade, because it's the symptoms known as problems coming from prescription drugs. So if that's not frightening enough, I'm going to read a couple of the headlines of this. You may need prescription drugs, and we're not saying that drugs are not bad in the warranted time that they really are needed for particular use. But millions today are suffering from the side effects of drugs, sometimes flippantly given, even over the telephone. What you need to know to protect yourself. The side effects of side effects. Imagine that. Experts estimate that tens of millions of people are suffering every day, often without even knowing why. There are lots of people taking drugs to treat the side effects of their own drugs. So, Dr. Bob, I gave you enough fuel before I even start reading another section. I know you're sitting there with bated breath going, oh my goodness, I have to touch base on that.
Well, I'm chuckling. Thank you, Lord, that you and I take no medication. The average Medicare patient watching us right now is taking 5 meds every day. I'm not even sure where to start. We have young kids that the number one drug that a child takes in the world today, and there's 45 million prescriptions for this, are asthma medications. So in our practice, because I'm a drugless doctor, I've been trained clinically as a chiropractor, I have a doctor of natural health degree. If you have a child that has asthma, I'm not telling you to get off the meds, just like Debbie just said, but it would be worth your while to come to Cleveland, Ohio, look us up, and have an assessment. If you live locally, just come to our community, Elyria, Ohio, and we'd be happy to do that. But then we have ADHD medications, but what concerns me are cholesterol meds they have kids on today, and diabetes meds, and antidepressants. It's about lifestyle, but here's my concern. Young girls. When I say young girls, I'm talking about anybody that's a teenager to 35 years old. They want to put them on Wellbutrin, Deb, and Paxil, Wellbutrin and Prozac. You mentioned thyroid conditions. A third of the world have functional low thyroid gland. So once again, our goal is to help educate you to make wise choices so your body will function optimally. Now, Debbie's going to go over some very important information. I know this will be available on the internet. I know that you'll be able to watch this over and over again. If nothing else, if you make appropriate lifestyle changes, Debbie, they'll save money because they'll get off their medication.
Well, it really is, you're right. Start with today being a different day for you, considering what your lifestyle is, considering what you eat, considering how much stress you have in your life, how much water do you drink, and how much sleep do you get. If you can evaluate those type of things and you see something that doesn't look right to you, you need to change. You've got to learn to take responsibility for yourself, because reading this article, no one else is going to take responsibility for you. Lynn's doctor still gave her the drug that caused her to be in the hospital. First of all, to experience symptoms that she didn't know where it came from, be in the hospital, and then you know what the real kicker is she still had a thyroid condition after they probably took her off the meds that was causing her to have the side effects. Nobody was getting to the real root cause of the problem, of the symptoms. So we need to help you do that. But I want you to know, how do you avoid drug reactions? Well, if you experience something and a change, you need to contact your doctor, of course. If you're taking several drugs, you don't even have to ask the pharmacist. Ask yourself, is all of the drugs that I'm taking, if they have side effects, how do the side effects of each of the drugs intermingle? And you know what? It's not even side effects. Sometimes it's a nutritional product that you might be taking, might not intermingle well with the prescription drugs. It could even be some sort of food you're eating, might not be mixing well with your prescription drugs. But sometimes we don't take the responsibility to read that little print that tells us what to eat and not to eat, and what to take with, or the mixture of other drugs together. The third thing is ask if there are lifestyle changes you can make instead of taking a drug. Oh my goodness, can you believe that, Dr. Bob? They're actually thinking that we could change through losing weight, exercising, even stopping smoking. Lifestyle changes are too hard for Americans nowadays. We just would rather pop a pill. Ask to be prescribed drugs that have been on the market for at least 7 years so they know about these drugs instead of the new drugs that have recently come out. Ask why the doctor is prescribing a particular drug. Find out the risks and benefits before you take that particular drug. Don't stop taking a drug without consulting your doctor. Now, that is both information for yourself and for you listening to us. You don't want to go to your medicine cabinet and throw everything away because you know what? You could experience bad side effects just from that. And lastly, it says review the medications that you are already on online. Use the internet to see what has maybe transpired in other people's lives because of the use of that medication. Dr. Bob, those are good.
It's really good, and it's just amazing. Okay, so let's talk a little bit before we take a break. Low thyroid. This is a shower dechlorinator. This morning, this afternoon, or whenever, most of you watching me probably took a shower in a 4x5 glass gas chamber. Breathing in that chlorine gas compromises thyroid function. In our books, especially Dr. Bob's Drugless Guide to Balancing Female Hormones and Dr. Bob's Men's Health, the Basics, we talk in great detail how to improve thyroid function. And most of the time, if that lady was in the hospital for 2 days because her thyroid was not functioning optimally, and so many times we have patients that come into our office that have been to their conventional healthcare provider and we're told they have normal thyroid function, even though they had body signals of cold hands and cold feet, wide-spaced teeth, thin, coarse hair, losing eyebrows, depression, by the way, constipation, high cholesterol, which we'll talk more about after the break. We help create strategies to improve function so the thyroid gland will work optimally. Now, I'm going to throw one comment to you before we go on break, is that if you're a menopausal woman right now and you're taking thyroid medication, I have read one of the side or bad effects of that includes osteoporosis. I've also recently read that a very popular medication called Fosamax can cause spontaneous fractures in women's thighs and hips. And they're actually saying now we are not telling any of you to go off any meds at all. I would definitely question your prescribing healthcare provider if there's something else that you can do to prevent osteoporosis. And I can tell you right now, the best thing you can do is get off sugar, because sugar depletes your body of minerals. We're going to take a short break, and we'll be right back. Hello, this is Dr. Bob and Debbie DeMaria once again with our Half Hour of Health program. And we have been giving you some very interesting information. And if you're taking any medications at all, or you know someone's taking a medication, get on the phone and tell them to watch the rest of the program.
Well, Dr. Bob, one of the things I know is you said that a lot of our Medicare patients are up to 5 meds per day. Okay, and sometimes really not 5 meds, but 5 different kinds of prescription drugs that you might have to take 2 or 3 times a day. So they could be taking multiples every single day. But what happens, Dr. Bob, when this one kind of mixes with this side effect and this side effect mixes with that side effect? And how do you actually know what's going on there?
Well, Deb, I'm going to throw out a very interesting mathematical equation to everybody. So you could get a piece of paper and a pencil, and I'd like you to write this down. One drug has 10 bad effects generally. So the difference between bad effects and side effects is marketing, because they really are bad effects. One has 10. Two drugs together exponentially raises it to 100. 3 is 1,000. 4 is 10,000. 5 is 100,000. 6 is 1,000,000. So if you're taking those 5 meds, you're having 100,000 reactions in your body. 6 is 1,000,000. 7 is 10,000,000. 8 medications is 100,000,000.
Wow.
9 meds. Right now, your body is so confused that you could have up to 1 billion interactions going on inside of your body. Now, we are living in a state in our society today, especially in America, called polypharmacia. In other words, nobody knows. I just had a lady that came into my office just yesterday that came out and told me that her health started to deteriorate once they put her on a drug to lower her cholesterol. So let me throw out 3 or 4 items to you right now. Your liver, oil filter, your liver is impacted by statin drugs. The #1 bad effect of statin drugs is liver disease. The simplest way to lower your cholesterol with lifestyle changes, that means get away from sugar and trans fat, is to eat Dr. Bob's ABCs, a half an apple every day, 1/3 cup of beets, 4 or 5 baby carrots. That'll lower your cholesterol. Beets alone, through research, will lower your cholesterol up to 40%. We briefly talked before the break about the thyroid gland. This is so serious. 1/3 of the patients that come into my office today have a low thyroid. Dr. Bob, why are you holding a shower dechlorinator? Because Debbie and I, when we take our showers, we have a dechlorinator on our shower. Chlorine is antagonistic to the thyroid. So is bromine, so is fluorine, which is so interesting. And Debbie and I have been doing and been a part of this TV program since the early 2000s. That when we've been talking about natural drugless care, it's like the rest of the world is finally catching up. They're actually lowering the amount of water, Deb, the amount of fluorine in water by law. So everything that we've been saying is definitely coming to fruition. Fluorine, bromine, and chlorine is antagonistic to your thyroid. If you have cold hands and cold feet, wide-spaced teeth, high cholesterol and depression, constipation, wake up with a headache in the morning that goes away as the day goes on, and you have been told your thyroid gland is normal, you go to the number on the screen and you make sure you get into our office. Because we have had guests on our program before that couldn't get pregnant because of a low thyroid. But I'm really talking to those of you right now who are depressed. I know, statistically, I just love statistics. 50 million Americans, 18% of our population, are on an antidepressant. The leading cause of depression is a low thyroid gland. Do you hear what I just said? The leading cause. That woman that was in the article that Debbie talked about the first segment went to the hospital because they gave her a medication because of low thyroid. So I would encourage you to have your thyroid checked. We can literally send you a kit anywhere in the world. You can do your own blood spot in the comfort of your own home. We can send it to a lab. If you don't have a healthcare provider, we consult with people worldwide.
Dr. Bob, I think one of the things that our listening and our viewing audience should really have an understanding is when they get medication, oftentimes they think that the medication is for that target specific area and it has no effect on other parts of your body. And I want to just mention here, you have discussed about Lipitor and you did talk about the effects of the liver. But believe it or not, Lipitor is also known to affect joints and especially knee pain. So if you're taking a drug, just for an example, a Lipitor or a statin drug of any sort, and you're getting an effect of pain in different parts of your body, joints, and let's just say your knee, can you imagine? It's supposed to be changing your cholesterol level to lower it, but it's affecting another part of your body. This happens across the board with all kinds of drugs, Dr. Bob.
Well, you know, Deb, my heart just goes out for all those that are watching us right now that are on medication and just don't know what to do and they're confused. Because, see, Debbie, when we talk about this in Dr. Bob's Trans Fat Survival Guide, I'd encourage you to get that book. We have a chapter on lowering your cholesterol naturally. Statin drugs work by tricking your body. Cholesterol is necessary. It's not good or bad. It is just there. It is like mortar between bricks. It's there. It's a basic building block. Without going into great detail, when your cholesterol oftentimes goes up, it's because you're under stress. You've been eating trans fat. You've been eating sugar. Stress is devastating what it does. Well, statins work by taking the cholesterol out of your body that helps make natural cortisone. Statin drugs also take the cholesterol out of your body for sexual function, hormonal function. So there are gentlemen watching us right now, Debbie, that are taking statin drugs and they have erectile dysfunction. Being very serious about this. So then you're going to take another pill to help your erectile dysfunction. And Debbie and I have a book called Dr. Bob and Debbie's Guide to Sex and Romance, and it's about getting healthy. You know, I have patients that come into our office all the time that are on medications for their hearts. I have oftentimes found, and we talk about this in our practice, that if your liver is compromised and blood flows through the liver on the way to your heart, you could have heart dysfunction because of a compromised liver. People take beta blockers and calcium channel blockers, and all these products are designed to literally alter the physiology. So many of you are taking medications right now that are water pills. And what you're basically doing, it's a diuretic that's eliminating vital, important minerals in your body. We started at the program saying not to go off any of your medication on your own. I'm going to reiterate that. You do not go off any medication unless you talk to your prescribing healthcare provider. But you need to start moving. You need to become proactive. By proactive, it means you need to start taking steps yourself. You know, I've read so many different articles that 95% of the health challenges that we are living with in our society today are lifestyle related. The number 3 killer of human beings in our society today is diabetes. Most diabetics are overweight. Not all overweight people become diabetics. There are bad effects and terrible side effects from taking diabetic medication. I know you're going to say, well, if I didn't take my medication, Dr. Bob, I wouldn't be healthy. So I'm trying to help those of you who have family members that are already diabetics. You need to start moving. Start cutting back on some of the processed foods. Because by taking processed foods, you're compromising function. Amazing, isn't it, Deb?
It is amazing, Dr. Bob. But you know what? We're trying to help everybody. See, I know my parents are 85 and 84. And it seems like when you get to a certain age, everything is difficult to function through your mind. So if we're trying to tell you this now, preparing yourself for better golden years, I think you should take this opportunity and start an evaluation on your own life.
Well, there are so many medications that we see, and our purpose of today is not to take you off the medication.
Exactly.
That is not our purpose, indeed. But the number 1 drug sold in the world today, which we'll talk about once again, is a statin drug, and that's Lipitor. Dr. Bob's ABCs, a half an apple every day, 1/3 cup of beets, 4 or 5 baby carrots. So let's say you have a low thyroid gland, or it's not functioning optimally, and you had some of the body signals that I told you about. You first want to make sure that you have the appropriate necessary blood test done. Write this down. A TSH. T, Tom, S, Sam, H, Harry. A T3 and a T4. Get Dr. Bob's Drugless Guide to Balancing Female Hormones, or Dr. Bob's Men's Health, the Basics. We talk about in detail of exactly what you need to do to improve thyroid function. Oftentimes it could take up to 2 years for that to happen. If you have a child right now that's on Ritalin, Adderall, Strattera, Clonidine, or any of the other medications that keep on popping up, Dr. Bob's Guide to Stop ADHD in 18 Days. It's about trans fat. You need to change your diet. I'm going to throw this off to you. Dairy products, oftentimes, especially yogurt, could be a part of your challenge because of the massive amount of sugar. Soda pop. That's another product that people take that can seem to cause a lot of challenges. Soda has a lot of chemicals in it. So what do? I want you to eat whole foods. Drink water from a pure source. Minimize refined grains. Some of your digestive distress could go away right now just by eliminating wheat and dairy. If you live locally in the Northern Ohio area, why don't you contact our office, have an exam, have an x-ray, we'll give you a report of the findings. I want you to go to this website, northcoastchiro.net. North Coast Chiro, CHIRO.net. Watch the welcome video. Watch the report of the finding video. If you feel comfortable and confident with what we're talking about, come into the office, make a new patient appointment. You know, I never thought I would have to say this, but it's a matter of life and death. 160,000 people die every year from properly prescribed medications. Call us today. You'll be glad you did.